Morning. Booster shots for the COVID vaccine are back in the spotlight. The FDA approved Pfizer's boosters for some people, and today a CDC panel will take up the issue.
News 8's Allison Royal live in Kearney Mason now with a closer look at what we can expect here. Allison?
Hey, good morning, Eric and Stella. So that's exactly what is going on. The CDC is taking a closer look, and it will decide just how these vaccines are going to be distributed, these booster shots. But one doctor with UC San Diego, she said, hey, be patient, listen to your doctor, and she does not recommend mixing vaccines. Take a listen.
Please do not mix vaccines. It's kind of like mixing antibiotics for an infection. You're going to create, it's not going to be a good outcome.
A lot of Americans have questions about the possibility of booster shots. Keep in mind, we are talking about Pfizer in particular here. Johnson & Johnson and Moderna are not as far along in that process, and granted, those two still have not received full FDA approval in general, just that emergency use authorization. Some doctors said a booster shot could sometimes be a refresher, right? So let me give you a little example. Kind of like when you go back to school at the end of summer and you need a refresher on math and some of the other skills you've learned. Well, sometimes your body needs a quick refresher on how to defend itself, and sometimes that's how those boosters can function. According to the FDA, booster shots would likely be available to Americans that are 65 years old and older, as well as people with pre-existing conditions. And then after that would be people who work in some of those high-risk environments. However, this is the CDC's call. So back out here, the CDC is meeting both today and tomorrow to discuss this, but there is that possibility that booster shots could be available as soon as this weekend or within the next week. I'm going to send it back to you, too.